let's talk a little bit about the article of Hamdi called When the State and Your Kidney Fail, Political Etiology, in an Egyptian dialysis ward. Before writing Lisa with Nier, Hamdi carried out research in Egypt with people suffering from kidney disease. And this article that you have read for this week talks about what she learned in this research. When you read the article of Hamdi, I would like you to think of some of the following questions. First of all, how did Hamdi do her research? Think about who she talked to and where did she do that? Why did she choose these interlocutors? What were some of the key insights? And also, how did she choose the places that she visited and spent time in? Why did she want to meet people there? What did she learn in this process? So think of how she organized her research, how fieldwork worked in her case. The second question that I would like you to consider is what her guiding questions were. What was she interested in? What did she want to know? And the other two questions that you might want to think about are, one, how does Hamdi's article help us understand Lisa? So for example, how does this article give us some additional context to the graphic ethnography? And what does it describe about health and illness in Egypt? And considering for a moment that this article was written before the Egyptian Revolution, how does Hamdi talk about some of the problems and issues that concern people in Egypt at that time? How does this, in a way, almost anticipate the revolution, or perhaps help us explain, help us learn, and help explain some of the motives of the revolution, why people actually eventually went to the street? Lastly, as a reader, think about the form of these two different texts that you're reading. What are some similarities and differences between an ethnographic article and a graphic ethnography? How do they explain social phenomena and contexts? And of course, what are the advantages and disadvantages of each? So think about your position as a reader and how you learn about similar issues and topics, even a similar place in the first part of Lisa, but through a different form. In her article, When the State and Your Kidneys Fail, Hamdi explains that she's interested in how the patients and the people around them understand their illness and their conditions. And she invites readers to pay attention to these explanations and perspectives. A key insight in her work is that a medical, individualized understanding of the cause of kidney disease is not enough to understand the realities of the illness in Egypt. The people Hamdi meets talk about how their kidney disease is linked to wider social, economic, environmental, and political problems that they witness. For example, they refer to pesticides and harmful chemicals in the land around them and in their food. They talk about water pollution, toxic waste that is not properly dealt with, and generally about an unhealthy, unsafe environment. All of these issues are historical and political, as they are linked to the roles and actions of the Egyptian government. In the words of Hamdi, on page 561, people trace connections between their illness and failed state policies. And this is also where the title comes from. The analysis of his patients, so their thinking, their perspective, is very important. Anthropologists have shown how illness, that is often just attributed to an individual sick body, is unevenly distributed in society. Or, as Hamdi writes on page 35 about Egypt, kidney disease is disproportionately experienced by the poor because of particular social structures that foster unsafe labor conditions, environmental contamination, unsafe food, urban poverty, and inadequate medical treatment. Hamdi visits hospitals and talks to patients in order to understand what it means to be sick and what the medical treatments are like that people receive, especially when they do not have many resources, when they are perhaps on a limited income. For example, something interesting that Hamdi writes about is how a majority of dialysis patients in the hospital that she visited end up getting hepatitis C during the treatment. This is something, of course, that makes their health even more vulnerable than it is already. And this creates a worrying paradox. Patients, as she describes on page 556, are, in her words, in utter dependence on the very state provision of services that they fear could further harm them. So we are dependent on the services of the state in around health and medicine that they are also worrying would be more hurtful to them. She also documents the old machines people need to use for dialysis, the long wait times, the unsatisfactory structures, for example, no working elevators to help patients, and the fact that the clinics are actually far from where people live, resulting in costly long trips for people who are already feeling unwell. At the beginning of her article, she documents all of this with very vivid and detailed ethnographic attention. And I want to quote from her article. This is from page 556. She writes, "In a dark waiting room of a semi-private makeshift dialysis center, I spoke with Sabri, the husband of a dialysis patient. He stopped in the middle of our conversation to help carry an elderly female patient sitting in a heavy, rusty metal chair from the dialysis center down 2 flights of stairs to street level. Their family members wailed as they were forced to hail a cab, a great expense for them, to take them to the bus station as the elderly patient could barely take a step out of a chair. Sabri returned out of breath, and we resumed our conversation. While we talked in the waiting room, loud shrieks penetrated the entire building coming from a dialysis center. Sabri struggled to take care of his wife, Kadra, and a young child. Sabri worked as a construction worker whenever he could. He said that the first 5 years of Kadra treatment were enormously costly. Before marriage, he had saved to be able to afford a place to live. Now the couple spent all their savings on medical treatment. So this is just an excerpt of what Hamdi describes, just a little example or anecdote. But through these and other examples, what I really appreciate is that she helps the reader feel or imagine what it could be like to be a patient or a friend or a relative, and how it is not just the illness, but also the way it is treated that impact people's lives, often making them face difficult decisions. So through this and other examples, Hamdi shows also that poor Egyptians are particularly affected by illness. And this is an important point that you will see also in Lisa. One of the reasons why many interlocutors of Hamdi do not want to undergo kidney transplant, for example, is because of its cost. Buying a kidney from an unrelated donor, as Hamdi explains, and paying for medicine and medical expenses is completely out of reach for most patients on a limited income. Transplant choices are also complicated in other ways. People are worried about the idea of taking a kidney from another person, especially if it is someone in their family. As Hamdi explains, there are some opportunities for transplant free of charge at one of the public facilities in Cairo, but usually that is dependent on having a relative who will donate a kidney to the patient. From the patient's perspectives, however, this would mean that someone else has to face the same existing unhealthy living condition that made them sick, but with only one kidney. Moreover, as the cause of a disease does not only rest upon a sick body, having a new healthy kidney might not make things much better on the long term, as there is no certainty, no indication that the patient receiving a new kidney would stay well. So there is this fear that both the person receiving a transplant and the one donating a kidney will actually get sick or be sick. So this article of Hamdi explains well what is meant in the graphic ethnography Lisa by the social context of disease, and how health, illness, and the decisions of patients are informed by and embedded in a web of complex social relations. So thinking for a moment about the character of Anna and her cancer risks in the book Lisa, the social context is very important. It does matter. For one, only some people are able to get genetic testing to see the risk of cancer. Anna, one of the protagonists in Lisa, is lucky to be able to pay for the testing, but many other people cannot access the service at all. The way testing is privatized and is so expensive has to do with the economic system and the social organization of medicine and science in the US. And Hamdi and Nieh talk about this in Lisa. For the other, on the other side, the way Anna understands the implications of cancer is shaped by her connections to people and communities. It's not just about her body and a disease that impacts the body. What is important is her connections with others. As explained in the companion website to Lisa that I refer to in the next lecture segments, and I am reading from that. This is like an excerpt from the companion website. As Anna sits in the waiting room and then meets with the counselor, we see the toll that cancer has taken on her family. There is no one there to comfort her, as she has lost all of her close relatives on her mother's side, and her father and friends don't fully understand. So the fact that this disease that breast cancer has affected her family and her maternal side of the family so much also means that Anna cannot really discuss these issues with any of them, which is really a tragic aspect of the story. Her father and friends don't fully understand because they are in a bit of a different position than Anna is. Readers also witness a double-edged sword of this genetic information. This again is from the companion website. She's grateful to be able to access this knowledge, but she's also overwhelmed by the difficult choices she might have to make if she has a BRCA mutation. The graphic novel also shows that Anna feels that she has, so to speak, lived with cancer all of her life, even if she was not sick herself, because she has been caring for her sick mother for several years, and so she knows the impact of the disease so personally. Her decision is also made complicated by ideas about the body, gender, and even future marriage. Her father, for example, is surprised by Anna considering surgery and asks, don't you want to at least wait until you get married? What about kids? What about breastfeeding? So all of these things make her decisions even more complicated. Returning to Egypt and the character of Laila, as Hamdi shows in her article, health is intimately tied to social conditions. The brother of Laila, for example, becomes sick when he's working in Saudi Arabia in construction. At that point, moreover, the company he works for finds out that he has hepatitis C, and so as a result, he's forced to leave Saudi Arabia, losing his job and losing, the prospect of getting better economically in the future, as his family is not very well off. As the companion website explains, many Egyptians contracted hepatitis C because of a medical error that occurred during public health campaigns in the 1970s and 1980s. They were treating or preventing a different disease, schistosomiasis, and they injected people with something that was contaminated. So that's how many Egyptians contracted hepatitis C. This all brings us back to some of the perspectives discussed by Hamdi's interlocutors about not just their bodies and their kidneys, but also the Egyptian state failing them as well. This idea that it is both the kidneys and the state that fails them, and that's why they're sick. So in summary, Hamdi, here as well in the graphic novel, asks what shapes the health decisions that people make. Economic, cultural, ethical, social, religious, even political reasons are all important in how patients decide on treatment options. Moreover, these aspects are not just important in themselves as particular reason or particular factors. It matters how they are all connected together. Even ethical positions, writes Hamdi, that we might think are very personal, individually held values, even ethical positions are shaped by people's conditions in society and the experience that they have.